które to spotkanie poświęcone jest szczepieniom, kalendarzom szczepień dla dorosłych, a organizowane jest w ramach Europejskiego Tygodnia Szczepień. Na początek, zanim przejdziemy do dalszej części dotyczącej powitania gości oraz wykładów, bardzo proszę, aby Państwo wszyscy wyłączyli telefony. To będzie bardzo przydatne, ponieważ podczas...
That would really be handy because during this meeting today, apart of all those who are here in the auditorium, we're also happy to welcome participants online, because you might know that we are broadcast, there's a streaming going on. So welcome. Welcome to the Ministry of Health, Chief Sanitary Inspectorate, World Health Organization, National Health Fund of Poland, and UNICEF. And now let me give the floor to the director of this institute, Dr. Bernard Waśko. Over to you, sir.
Dzień dobry Państwu.
Good day, ladies and gentlemen. Since we have those international guests with us, let me welcome them in English first, shortly, and then I will resume speaking in my mother tongue.
First of all, I'd like to warmly welcome our representatives from international organization and especially our distinguished partner WHO, represented by Mr. Nino Berzulli. Warmly welcome. And from UNICEF, Mr. Agron Gashi. Okay, welcome. We have also representatives of Ministry of Health, Ms. Joanna Kujawa, and Deputy Minister of Chief Sanitary Inspectorate, Mrs. Izabela Kucharska. Not yet arrived, but will be soon. Proszę Państwa.
Ladies and gentlemen, the theme of our event today is supposed to broaden the minds and develop awareness, because there seems to be a common misconception that immunization is just for children and adolescents. But the fact is that with the demographic shifts in our society and the evolving landscape in health, especially health of seniors, as these challenges evolve, there are new risks related to chronic conditions. And also, given the progress in medicine, these risks can now be managed better and better, hopefully. So preventive medicine is the lifestyle, the diet, and last but not least is also the immunizations. There are more and more products available to deal with various epidemiological threats. They help us reduce the risk of morbidity, especially in those who are particularly vulnerable to chronic, to infections because of chronic conditions, because of compromised immunity, etc. So I believe that's our job today, to build awareness, to make people understand, especially now during the European Immunization Week, which, as always, celebrated in April, and it has just started. It started 2 days ago. So this event is one of the highlights of this celebration. I suppose that if you were to ask your average, well, I'm not sure about average, because an average person wouldn't be able to name one vaccine for adults. But if you asked a few everyman, maybe one person would be able to say, hepatitis B for adults, maybe flu shot. Now, after the COVID pandemic, maybe one more is vaccine they could name. Whereas the truth of it is that there's many, many more vaccinations that address various epidemiological risks for adults, for children, for adolescents. We are going to discuss them today. Have a good meeting, have a good day, and let me pass the floor to the next speaker. Thank you. Thank you so much, sir. Now let me give the floor to the Ministry of Health representative, the head of Environmental and Public Health Unit, Joanna Kujawa. Madam, the floor is yours. A very good day to you all. I am truly honored and privileged to welcome you on behalf of the Minister of Health, who took patronage, honorary patronage over this conference. The topic is high on the agenda. It's a very special time, European Immunization Week. Each and every one of us here understands how relevant the topic is. It's part of our day-to-day lives. It affects our children, it affects our parents, it affects our loved ones. I believe we have full awareness as to why immunization, especially in adults, has significant impact on public health. And now we hope to spread this information, to build awareness so that immunization is something people know about. It should never be a taboo. It should never be an urban legend. It should never be mystified. So let's debunk those myths. Let's focus on knowledge, evidence, new developments. Let's delve deep into the subject, which deserves more attention on mass media and on social media as well. We must do our best to make sure that vaccinations get into the spotlight. They are the weapon to fight infectious diseases, and they are a weapon to fight misinformation, which has been quite prevalent recently among children, among adults. There's some things that are not true being said, so that's why we need to propagate scientific evidence. Hence this meeting today. It has a powerful communication purpose. Dear Sarah, I'm addressing the director of the Institute. Thank you so much for helping us get this organized. Big acknowledgements to all the guests, without whom this would not be possible. I would like to acknowledge WHO, World Health Organization, UNICEF, and all partner organizations which tirelessly promote and support immunizations. Also, on behalf of the Ministry of Health, I would like to ask your support. Join us in promoting Szczepienia Info portal, immunization info portal. It's a website with knowledge, leaflets, source material, one-stop shop, all on one platform, which is dedicated to serve medical professionals, patients, public officials. I hope it will be a tool that we can all use. So thank you very much for all your assistance, and that's all from me. Thank you, madam, for these kind words. Kind words, especially to the editor-in-chief of our portal, Szczepienia Info. So we appreciate those compliments and praise. Now let me give the floor to Minister Izabela Kucharska from the Chief Sanitary Inspectorate. Good day, Madam Minister. Thank you and good day to you all. dear Director, Madam Professor, Madam Director, ladies and gentlemen, it is a major event today. Now that we are celebrating the week of immunization, we have good 7 days to celebrate all things vaccines, including immunizations for adults. As the Chief Sanitary Inspector, we've been engaged in a number of promotional efforts. We've done some campaigns, we've done some local and regional drives to promote immunizations. Yet, it's not enough. It is still not enough. We have to say all hands on board, because there are so many people who dislike vaccinations, who go against it. We've done some research, we have done our observations as a government administration authority, and we have found out that the main reason behind the rejection is disinformation. People are confused. Should I? Should I not? Is it the right idea? Is it the wrong idea to get vaccinated? Also, among adult population, there seem to be more and more people who would like to be immunized, but they are being discouraged by their friends, even sometimes by doctors. You know, personally, I'm a patient in a primary healthcare unit, and I was not offered a flu shot. I was actually discouraged from taking a flu shot amidst the flu season. It's my personal experience. And also one day, I was going to a tropical country on a trip, and in the travel agency, when I was buying a ticket, I made sure to ask, do you recommend, as a travel agency, it was a major travel agency, okay, nationwide, do you recommend any vaccine to people who go to this country, you know, tropical country? He told me, madam, no, these are, you know, bygones, no more, no need for a vaccine anymore. So you see, there's a lot of work to be done. So if I may come with an appeal, whether you work in medical field or not in a medical field, I'm asking you all, please, let's join hands in this worthy effort under the tested and proven leadership of the Ministry of Health. I hope to see a major nationwide campaign, hopefully with the support of other ministries as well. What ministries? Well, mostly the Ministry of Education is on my mind, but perhaps also the uniformed ministries. We have the Chief Sanitary Inspectorate for the Polish Army here. We had a chance to speak on the importance of vaccines for those adults who, you know, wear uniforms. They are there for national defense, so they need to be safe and secure as well. So I'm glad to have you all here, delighted to celebrate this full week for immunization. It is a topic worth our while, that's for sure. What more can I say? Thank you, dear Director. Thank you all. And let's join hands for this worthy cause. I hope our voice will be well heard. And maybe it will counteract this confusion and buzz or noise in the society when people come up with questions about vaccines. We always try to answer a question, to address all the main concerns and fears, to promote vaccinations. So I hope we'll see the fruit of those actions soon. Because when I look at the KPIs or the indicators, the vaccination rates, I'm not saying they are bad, but there are more and more rejections. People refuse to be vaccinated, which worries us a lot. So thank you very much. Have a wonderful day. I look forward to interesting facts, to information. Thank you. Thank you, madam, for your words. We absolutely hear you. We sympathize with what you said, and I hope that all of us in the future will prevail over misinformation, misleading stories, so that we can all present the key facts, which is evidence-based, key facts about vaccinations. I am delighted now to bring back our distinguished guests, thanks to whom the European Immunization Week, the Global Immunization Week, has become a permanent fixture in our annual calendars in Europe and globally. We are lucky today to have with us the director of WHO office in Poland, Madam Nino Berdzuli, and Dr. Marek Muscat, who represents the regional WHO office in Copenhagen. Welcome to you both, Madam, Sir. Now, Dr. Nino Berdzuli, would you please take the floor to inaugurate this event? Thank you.
Thank you very much, and I hope the presentation will be shown as well. So, good morning, dzień dobry. It's very nice to see you all here. It's a full room, and I'm sure there are a lot of people that are online watching us streaming, so that's very nice. I'm very delighted to be here, to join you, to join the Institute of Public Health, and thank you so much, Director Vashko, for inviting the WHO, and we're proudly co-organizing this meeting, this conference, together with the Institute of Public Health and the Ministry of Health. As you know, we are celebrating the European Immunization Week. We are marking the European Immunization Week, and the focus of this year week is vaccination across the generations. And we also celebrate 50 years of expanded immunization program that WHO, the World Health Organization, launched 50 years ago. And there is so much to celebrate since then. Countless of lives have been saved because of the immunization. And we all know, and there is no need to convince this audience, that the immunization is the most remarkable success story of the humanity. We know that immunization plays the pivotal role in safeguarding health and the well-being of individuals. There is no need to convince this audience and talk about the benefit of the vaccination, but what I want to highlight is that in the context of emerging infectious diseases, in the context of the global health security threats that we are facing today in this era, in our daily life, it is more than important to have the focus on the immunization. It's more than important and more than evident the role that the immunization plays in saving the lives of individuals, but also in safeguarding the public health, safeguarding the social fabric and our fabric. So that is very, very important aspect that I wanted to highlight and to bring your attention. From COVID-19 pandemic to the resurgence of the vaccine-preventable diseases, we are reminded every day the critical role that the vaccination plays. WHO European region did very recently the study, and they published a report, and this is available on internet on the WHO website, that showed that the COVID-19 vaccination actually saved more than 1.4 million of lives in the European region between 2020 to March 2023. This is a remarkable story, and a remarkable story of vaccination across the life course, vaccination across the generation, because COVID-19 vaccine is a good example of vaccination across the generations. We have good progress to celebrate, that's obvious. But we also have the challenges that we are confronted every day. And those challenges were already mentioned by the previous speakers. Vaccine hesitancy that is fueled by the distrust, mistrust, the misinformation about the vaccines that we have to fight and we have to address every day. Vaccines cannot escape the political and the social turbulence. That is very clear. And what we need to do tirelessly as public health and the scientific community and as frontline healthcare workers to fight this disinformation, to bring the evidence, to bring the science and the facts so that our healthcare workers are equipped and they are confident to proactively engage with the patient. And we've heard a very interesting personal story from Minister, from the Deputy of the Chief Sanitary Inspectorate about her personal experience, with the healthcare provider. So it is our job and it is our moral obligation tirelessly to engage with everyone, with the public health community, with the healthcare workers, to increase this confidence in the vaccines, so that the healthcare workers proactively engage with the patients and they feel confident to engage in conversation with those that are hesitant or that are not decided to be vaccinated. I have several slides that I want to bring to your attention, and just to set the stage a little bit, because we are going to have during this conference talk about the vaccination, live course vaccination across the generation. We're going to address the adult vaccination. So it will be good to set the stage and remind us, what do we mean by the live course approach to immunization? It's actually a strategy to prevent the diseases and maximize the individual's health regardless of the age. And live course approach requires that the immunization schedules and the access to vaccination respond to individual stages in life, from the newborn to the older person. And we know that the strategies may differ from childhood vaccination, in the case of the childhood vaccination and the adult vaccinations. The settings, the clinical settings where the vaccination is offered may be different. The conversation that we need to have with the patients and with the mothers and with the adult people may be different. So these are the things that we need to be taking into consideration, bear in mind. There are tremendous benefits of immunization across the life course, and there are many vaccines that we have handy that can be deployed across the different stages of life. Immunization during pregnancy that can benefit women and the baby, and we have many examples from the European region countries about successfully deploying different types of vaccines during the pregnancy, whether it is the flu or, for example, the pertussis. Adolescents and the young adults is the best time to immunize against the HPV vaccination. And this is very, important story, success story. For the first time in the history, in the life, we have a chance to eliminate the cancer, to eliminate the cervical cancer. This is remarkable story. What we need to do is to put all our efforts to ensure that there is a high uptake of HPV vaccination so that everybody can benefit from these very important life-saving tools. And we have many countries in the European region that actually are on the path of eliminating cervical cancer because of successful vaccination strategies and deployment of this HPV vaccination into school, into the communities, many strategies. High uptake in UK, in Sweden, and these are the countries that are on the path in few years to eliminate the cervical cancer. And many other vaccines that we have in our hands that can be deployed during the different stages of life. And I want to emphasize also here that beyond the individual benefits, of course, there are a number of population-wide health and economic benefits of live course vaccination, and this is very well known. We are confronted with very difficult challenge, antimicrobial resistance. So in the past, it was called as a silent pandemic, but it is not silent anymore because there are so many people that are dying, from antimicrobial resistance because, we don't have successful tools to treat the antimicrobial resistance, and we're going to be confronted with even more with this challenge. But we actually don't or underutilize the power of vaccines to address the antimicrobial resistance. And if we talk about only flu, influenza, and we know that in some of the countries the coverage for the flu vaccine is very low. So let's think about it. that some of the challenges, that we are confronted with can be really tackled with the simple tools, with the effective tools that we have in our hands, but they are not effectively used. And all this addressed through the European immunization agenda that was put forward by the WHO, by the World Health Organization Regional Office, and approved by all the member states of European region at the regional committee several years ago. And the vision of the European immunization agenda is the world where everyone, everywhere, and at every age fully benefits from vaccines for good health and the well-being. And there are three important objectives, or the goals, actually, in the European immunization agenda: reducing the morbidity and mortality, increase equitable access to vaccination, and the strengthening the primary health care that contributes towards the universal health coverage. And the key pillars of the European immunization agenda is equity in the immunization across the life course that we are addressing today, and the local solutions to the local challenges. Inequities here is the key word, and we know that without addressing inequities, without addressing the pockets of unvaccinated, under-vaccinated population groups, we won't be able to achieve immunization equity, and we won't be able to achieve the goals of the European immunization agenda. Measles, actually, it's a very good example. We see the resurgence outbreaks of the measles in the European regions, and some countries in the EU, including, are facing quite a significant challenge with these outbreaks. 58,000 cases of measles were reported in the European region in 2023, and during the first quarter of 2024, we see significant increase of measles cases in the European region. And if we think about the measles actually is a equity virus. Measles actually is a proxy how well the immunization system works and how robust is the vaccination program is in the country. So let's think about this. And of course, addressing those equity issues and the gaps in the immunization, we need to talk and we need to understand why we are facing this equity. What is the population that we are facing, this unvaccination and under-vaccination? And for these specific populations, we need to have the local solutions that will address these local challenges. And this is actually the foundational principle of the European Immunization Agenda 2030 that the WHO has put forward and works with all member states to address this gap. So again, I talked about the why immunization equity matters. Without immunization equity addressing this aspect, we won't be able to achieve the European Immunization Agenda 2030 targets. We're putting individuals and the population groups with lower vaccination rate coverage at the high risk of vaccine-preventable diseases, outbreaks. And as I mentioned, immunization inequities actually is also a tracer for the broader health inequities. So, couple examples, and I mentioned already the influenza coverage rates. So when we talk about the inequities, we speak about the inequities between the countries, and we speak about the inequities within the countries. And this slide actually provides the good overview of the inequities in the immunization coverage for the flu influenza vaccine across the countries. And Poland, as well as the number of other countries, also has some of the low vaccination coverage with regard to the vaccine rate, influenza vaccination rates. It is very important to understand also the reasons behind the low vaccination rates. Is it only the confidence issue in the vaccine? Is it only the hesitancy to the vaccine? Or actually it is the convenience factor? Is this health system offers user-friendly services? Is registration, getting the appointment is easy. Are the health systems able to provide the services that are convenient for the people? So there are a number of aspects, there are a number of factors that we need to consider when we talk about the vaccination coverage. And with regard to the MMR, again, Poland did a great job in vaccination, measles vaccination coverage, and many countries during the pandemic, and especially the first in 2020-21, faced the serious issues in terms of the backsliding on the measles vaccine coverage. And there is the recovery and the uptake of the measles MMR vaccine for the first dose and for the second dose as well. But we need to be also very vigilant. What are those communities? What are those population groups? Which areas, the geographic areas, are particularly struggling with the coverage? And pay attention to those groups and to those geographic areas, so that there are local solutions that we develop to address these local challenges. So this is a slide actually that comes from from the Institute of Public Health, but it's a little bit, it's from 2022. I hope that there is the data that is also from the 2023 available, and I'm sure that this will be presented later. So my message again today is that we as public health and the scientific community really need to work tirelessly to engage with everyone, with the community, with the healthcare workers, with the politicians, to increase the confidence, trust in vaccines. So this is our daily job. This is not only within the European Immunization Week, but actually work continues after the Immunization Week. Thank you so much.
Bardzo, bardzo dziękujemy.
Thank you very much for this introduction. And now it's time for presentations concerning vaccination schedule among adults. And I would like to invite Professor Ewa Augustynowicz of Etiology unit from the National Institute of Public Health. And she will be presenting a lecture about vaccination aimed at adult population, adjusted for lifestyle, profession, and other factors. In other words, she will tell us why adult patients need vaccination. Well, today we're talking about lifelong vaccination, but I would like to start from a renowned picture in the history of vaccinology, which depicts a boy who has been vaccinated and has not been vaccinated.
Dorosłych czasami w naszej świadomości jest takie postrzeganie tych szczepień jako czegoś nowego. Nie. Szczepienia, mechanizmy dotyczące uodpornienia wtedy, kiedy szczepionkę podajemy osobom dorosłym w różnych grupach ryzyka, właściwie działają tak samo jak te wypracowane i poznane przez nas od dziesiątek czy nawet setek lat u dzieci i młodzieży. Kalendarz szczepień, program szczepień ochronnych, zwany popularnie kalendarzem szczepień w Polsce, mam nadzieję, że Państwo znają tą infografikę, w Polsce my przynajmniej w tej strukturze, gdzie są szczepienia obowiązkowe, stosujemy już od początku lat 60. ubiegłego wieku. I mówię to też dlatego, żeby podkreślić, jak dużo już wiemy o szczepieniach i jak długo się nimi zajmujemy. I tutaj dzięki właśnie realizacji szczepień podawanych w ramach powszechnych programów szczepień, szczególnie szczepień obowiązkowych, udało nam się jak gdyby trzymać pod kontrolą, czy wręcz wyeliminować wiele chorób takich z użyciem tych bazowych szczepionek podawanych w ramach kalendarzy szczepień. Tutaj na grafice przywołuję Państwu efekty działania chociażby szczepionki przeciw błonicy, przeciw krztuścowi, przeciw odrze, przeciw gruźlicy, przeciw poliomielitis, wirusowemu zapaleniu wątroby typu B czy różyczce. Bo już jakby obecnie wiemy, że szczepienia dorosłych są tak samo ważne jak szczepienia dzieci, ponieważ w przypadku wielu chorób zakaźnych, a tutaj najczęściej przywoływanym przykładem w tej sytuacji jest na przykład pneumokokowe zapalenie płuc czy grypa. To są sytuacje, kiedy nieuodpornieni dorośli są narażeni na zachorowania i powikłania w przebiegu tych infekcji zdecydowanie w większym stopniu niż dzieci. Nawet ryzyko zgonu w przebiegu chorób, którym można zapobiegać szczepieniami, u osób dorosłych jest zdecydowanie wyższe, czy w porównaniu do dzieci. Nawet na stronach CDC mogą Państwo znaleźć taki przykład, że to ryzyko u dorosłych jest nawet 100-krotnie wyższe.
You can see the risk increases in adults compared to children. So, perception of vaccinations, in line with the slogan that we share during this European Vaccination Week, allows us to be even more brave than before. So this is really an essence of healthy life. Don't smoke, eat healthy, sleep regularly, move, and get vaccinated. These are all elements which help us maintain health, and they improve the quality of our life. And they also extend our healthy lifespan. A few days ago, I attended a course organized by Vaccination Society, Polish Vaccination Society, and there was a speaker, Professor Leszek Szejber, who mentioned that adult vaccinations in fact, let us stay young for longer. And I believe this approach to discussing, to having a dialogue about vaccination is crucial, because this subject is very broad. And here we also discuss obligatory training. For instance, we offer one dose one booster of vaccination among 19 years old patients, also post-exposition vaccinations, and our vaccinations aimed at people who are particularly vulnerable given their epidemiological conditions. And recently, we also introduced charge-free vaccinations among patients with impaired resistance.
Finansowania.
All right, to learn a bit more about the topic, to make it better known, our institute, together with the vaccinology experts, we have developed not a program for adults, but programs, vaccination programs, plural, for adults. Let me give you an example. Just an example of the options, how diverse the programs can be. That's the diagram that we have prepared. Adult immunization, age-based. The entire adult population, age-based. So if you discuss it one by one, you can see the differences. One thing is the recommendation or the vaccines recommended for a person in their 20s or 30s, in contrast someone who's in their 60s, 70s or 80s. So without a doubt, I mean, everybody agrees that in adult immunization, the key point is to vaccinate the seniors, the elderly citizens. They are the ones who need it more than anyone else. The statistics are quite cruel. Poland has been getting old, our society has been aging, and when you read the statistics carefully, they say that by 2050, 60-plus population will be twice as numerous, and 80-plus people will be 4 times as numerous as today. And obviously, the older you get, the more compromised your immune system is. Immunosenescence is the name for it, for this phenomenon. The organs, body organs tend to change in terms of the number of immune cells, antibodies, but first and foremost also the activity of those immune cells and antibodies. So how many and how active they are. That's why you have a dedicated immunization program for senior citizens. Another special group that needs a dedicated program is women who are pregnant or who intend to get pregnant in the nearest future. There's also a diverse group of adults with chronic conditions or comorbidities of all walks of life. You know, some of these comorbidities will be taken on the agenda today, like diabetic patients, respiratory tract disease patients, CVD patients, chronic liver or kidney patients, patients with compromised immunity, like the spleen dysfunction, rheumatology patients, or patients who are infected with HIV. And actually these groups go on and on. Each individual group needs a dedicated vaccination program of their own, so to speak. Of course, the scope of vaccination will overlap to a degree from one group to another, but nevertheless, there are some stark differences from one group to another. Now, to help you with the interpretation of the graphic presentation, our experts have drafted the guidelines. These are guidelines for adult vaccinations. One guideline is for medical professionals, and another guideline is directly for patients. Please help yourself, make sure you collect the guidelines. They are available on our website, Szczepienia Info, you can download them. What else on the website? There's a lot of graphic material, a lot of footage, videos, e-books, you name it. I just want to say that, you know, some of the material has been designed with a patient in mind, and some of it with a medical professional in mind. We'd like to build this database of knowledge on vaccinations for patients and for medical professionals. Because with this new quote-unquote topic of adult immunization, medical professionals are the group to be addressed and targeted in the first place, I believe. They need to learn more about the topic in the first place. Look at the graphics on our website. There are some useful tips and clues, you know, for patients, for medical professionals. Why are vaccinations beneficial, adult vaccinations specifically? What are the benefits? So there's a lot of them, but for now, let me just focus on a reason whereby an adult who gets a vaccine, especially when they live with a small baby in the household, or they have a person who is very poorly in the household, someone who's very sick and has compromised immunity, they obviously contribute to better health of their loved ones. It's like a cocoon strategy. So that's yet another reason why it is good to get vaccinated as an adult. These benefits are ample. There's lots of them. When you read our material, you will find it all there. Until recently, in the medical community, medical community meaning physicians, but not just physicians. Adult vaccination, there's a lot of different type of medical professions dealing with adults. So until recently in this community, there was this common perception that there's not enough recommendations, so the recommendations are not convincing enough. But that has changed over the last 2 years. The experts have come up with a lot of Polish recommendations, Poland-based, published, available in the open. And when the recommendations were first drafted, we had a diverse group of experts involved from various medical fields, various scientific societies and associations in Poland. And even when you read the heading of the recommendation, or when you read the acknowledgements, you will see how diverse the background was based on which this guideline was developed, guideline or recommendation. So please, be brave, don't be bashful when you talk to primary healthcare physicians and other medical professionals. Please try to persuade them that there is a very good cause, very good case for adult immunization. Needless to add, it all starts with vaccinations of healthcare professionals. That's absolutely, the first step. We have followed WHO recommendations on medical professional vaccinations, so we have followed on those guidelines. Protect yourself first, protect your loved ones, protect your patients. All of this, plus be a role model. Be a role model. Set the tone. Set the example. How can you expect, a pharmacist, a nurse, a physician to persuade their patients successfully if they themselves have not been vaccinated or they haven't cared enough to get vaccinated? If they are negative or at best indifferent towards vaccinations, they will not be trustworthy. Whatever you do has to be based on trust. So whenever you come across our website, Szczepienia Info, you will see the names of institutions that are behind a given recommendation. We are particularly proud to have collaborated from the get-go, from like 15 years ago, with the Polish Vaccinology Society. This distinguished society has been our partner from day one, as I said, and we cooperate on a day-to-day level with those vaccinology experts under the auspices of the society. We try to keep it accessible, user-friendly. We try to speak the language that everybody will understand. Because adult vaccinations isn't just individual protection or maybe indirect protection. There's more. There will be a lot of additional benefits, non-specific benefits, so to speak. Let me quote findings of a study. It was a systematic review, meta-analytical review of 2022, a very big sample, over 1.8 million participants. And the authors concluded that there is evidence for a cause and effect relationship between adult vaccination and lower risk of neurodegenerative diseases such as dementia or Alzheimer's, So these benefits may be direct, sometimes they may be indirect when you get regular flu shots, when you get the booster for pertussis, when you use shingles vaccine, or even like for hepatitis B or hepatitis A. All of that makes a difference. One of the most common questions, at least the questions that we tend to get in our institute, vis-a-vis adult vaccination, is a question on how can I check, or where can I check my vaccinations to date. This is a tough nut to crack. We really can't wait to see the electronic vaccination record. That would really be a game changer. But on Szczepienia Info portal, you can find some tabs to help you check potentially your vaccinations done. This is not equal to medical records, mind you, but this is a bit of a clue when you talk to your physician, like when you ask them what strategy should I apply, how well vaccinated am I? Maybe they should check your antibodies, or maybe they should start the entire cycle from the start. So check our website, look it up. You will find some resources for that. Vaccinating pregnant women. This is nothing new under the sun, believe me. Vaccinating pregnant women, well, like in the previous century, in the 20th century, we were able to eliminate tetanus in newborns, thanks to pregnant women being vaccinated. More recent example, flu shots, pertussis vaccination, COVID-19 vaccinations, and in the nearest future, we might have access to this RSV vaccine. So there's a lot of new options to be paid attention to. Once again, let me advertise our website, Szczepienia Info. It's one of the biggest reliable web-based sources on vaccinations in Poland. Adult patients and patients from risk groups do need immunization. Seniors, because of age, because of aging of their immune system and comorbidities, they are obviously more exposed to the risk of severe course of an infectious disease. When you're an adult, check your vaccinations to date, get the boosters, get the new vaccines, depending on what you do in life, depending on the type of your job, your lifestyle, your age, and whatever chronic conditions you might have. We also need to implement guidelines for patients from group risks. We need to promote that among healthcare professionals and among patients themselves. So on a final note from me to you, a quick wish. I hope that very soon we will all be pro-vaccine as this young man in the picture. Thank you, Professor, for this great presentation on vaccination program for adults. And moving on, we are going to talk a bit more about adult immunization, but from the angle of certain risk groups. What can the risk be related to? Well, first and foremost is the comorbidities. Typically these are chronic conditions that manifest themselves throughout the life course, ever since the diagnosis. We have selected but a few conditions to discuss in greater detail. We shall start with respiratory system diseases and CVDs, cardiovascular diseases. I couldn't be more honored and I couldn't be more pleased to give the floor now to Professor Jacek Wysocki, the chair of Polish Vaccinology Society. Professor will deliver his presentation via an online platform. We regret he couldn't be with us today here in Warsaw. So, Professor, over to you. I hope you can get good connection. Good day, good morning. On behalf of Polish Vaccinology Society, I would like to congratulate you on the celebration of this adult immunization program and the event dedicated to that cause. You are a part of the European Immunization Week, and adult vaccination is one of the pillars of that celebration. Why? Why has adult vaccination become so important? Well, I need not remind you, on the one hand, Europe has been aging. We have more and more people who are seniors. And on the other hand, we have more and more younger adults who are affected by a broad spectrum of chronic conditions, and as such, their immunity is compromised and they are more susceptible to a very severe course of an infectious disease. That's why vaccine makers have now been able to provide more and more useful products. But having a product is one thing, the other thing is to roll it out, to put it into good use. Our society, for a few good years now, has been collaborating very closely with the experts who deliver recommendations and guidelines on gynecology, cardiology, pulmonology, oncology. So hand in hand, we've been trying to draft recommendations and guidelines for immunization. But we also need a large-scale educational effort for the general public at large to make everybody understand that adult vaccinations are important. The National Institute of Public Health is a great actor in that. For many, many years you've been doing prevention and health promotion. I have no doubt that you will be one of the key stakeholders to make sure that adult immunizations become more prevalent in the society. In the past, National Institute of Public Health and Polish Vaccinology Society have worked hand in hand, and this collaboration continues. So all that's left for me is to say that we look forward to our continued cooperation to promote immunization, which is our common interest, obviously. I really wish I could be with you there in person. I wish I could come to Warsaw, but something unexpected popped up in my alma mater, my university. I had to stay in Poznań, where I'm based. But I am going to attend this when Dr. Małecka delivers a presentation. We prepared it together, so in that way I will be present among you. Finally, let me congratulate you on this wonderful event. I hope you will have a good day and a fruitful discussion. Thank you. Thank you, Professor, for your kind words. And as Professor just announced, I will now give the floor to Dr. Ilona Małecka from the Department of Health Prevention, Poznań Medical University. Dr. Małecka will talk about immunizations for respiratory and cardiological patients. And a short comment, by the by, if I may. The speaker who will deliver the presentation now has been working tirelessly on vaccination promotion. She has amazing energy. She's very charismatic. So after this presentation today, I hope you can borrow some of her energy. I hope that we will all feel re-energized to pass the baton and to continue working. Well, thank you so much. Thank you so much. You really make me feel even better. And what you said gives me even more impetus to work hard. It hasn't been easy. Ever since I'm educating parents and all kinds of patients, you know, it is not an easy peasy job. I'm a pediatrician, so why pediatricians speak about adult vaccination? Well, if I had not become a pediatrician, I would have not focused on immunization. The vaccinology is across generations. As young as you get, as old as you get, think about pregnant women getting vaccinated, right? And their babies in the womb. And it doesn't have any upper limit, right? So the sooner we accept it, the better. That is the fact. Medical professionals and patients should be aware of that. So if you ask me about COVID pandemic, is there any benefit from the pandemic? Well, I will say it once again. Yes, indeed. The COVID pandemic was positive in terms of its impact on our awareness that, yes, if you're an adult, you should also get vaccinated. A vaccination is not something that can cause harm. A vaccination is something that can save your life. So that is probably the only benefit of this very sad event of pandemic. Professor Augustynowicz already said it over and over again. Why should we vaccinate as adults? What are the benefits of adult immunizations? So let me just reiterate one key point. Whenever you're a senior or you have comorbidities or chronic conditions, if you take medications on a regular basis, we shouldn't say, let's not vaccinate that person. What if it will affect them in a negative way? Let's not vaccinate them because they might become even more sickly. No, just the opposite. Let's expand the vaccination program. Let's teach them about prevention to help them keep the optimum level of health as good as possible over as long time as possible. You've seen the graphic information. Actually, I love the layout. I absolutely love the conference material, the handouts. I had not seen it before, so I'm absolutely enchanted with the way you address that topic. Simple, fantastic for every family physician to be put on their desk. It should be like a permanent fixture in any medical surgery, because it's easy for a patient to see. It teaches them that vaccinations are useful, beneficial, and also the vaccination programs per patient group. Like you see, respiratory diseases, CVDs, that's quite relevant because, yes, you could have one common program. Yes, you might do that. But once you have a dedicated program per patient category, depending on the health condition, I believe it will be embraced much more happily. Why? Because it's tailor-made. It's dedicated to a specific type of patient with that specific health problem, living with that specific chronic condition. So it is tailor-made, to repeat that phrase.
Professor Augustynowicz has already mentioned that vaccinations will not be successful if we, the vaccinologists, do not cooperate with other associations, for instance, with the cardiologists, pulmonologists, diabetologists, and others. We need to cooperate both ways, and together with the National Institute of Public Health, we are trying to achieve that objective. We are trying to accommodate them with this subject. So that's also a fact of COVID. Now, doctors of other specializations during COVID-19 realized that vaccinations are helpful. They do not cause any harm. And the whole problem with COVID started with patients who were seniors and who had comorbidities. And now I would like to put some emphasis on certain pathogens which are specifically important in adult population. Pneumococci, we know that in the context of children, we know that they cause numerous infections of different intensity. But among adults, pneumonia is of special significance. It's never just pneumonia. I assure you, this is not just an infection. This infection among older patients causes irreparable consequences which affect their quality of life. So if you look at the risk group among patients with pneumococcal infection, these are cardiological patients and patients with cardiovascular conditions or pulmonary conditions are absolutely in a risk group. What does it mean? It means that they will be they will tend to get infected more, but also their infections may have a stronger impact on their primary condition. And we also noticed synergy of pneumococci with other viruses, like the flu virus. Look at the details. Every third patient hospitalized for flu, in every third patient, pneumococci was confirmed. So it shows us the picture of the clinical condition and how important prevention is. All these are results of scientific research. I will not read out all the numbers. You have that in your presentations, but look at the charts. It's evidence, it's scientific evidence based on global research. And look how the risk of hospitalization increases based on what you get infected with. So really, the risk of hospitalization because of pneumonia caused by pneumococci is 9 times greater compared to other patients who do not have chronic lung diseases. But another chart shows the situation of cardiological patients. So see, this disease is does not only affect people who have lung diseases, but also because of certain toxins, like pneumolysine, they also have negative impact on heart cells, heart tissue, and they may cause arrhythmia and different heart conditions. So you see, once you had a heart condition, you will never be equally healthy as before, just because of a pneumonia. So in a society, we as a society, we tend to say this is just an infection, just a flu, just a pneumonia. And we know that it's not just that. The context may be much more different, maybe more severe. Look at the complications in cardiovascular patients. Already in 3 days from the onset of infection, the risk of a heart attack is 6 times greater, and of stroke it's 12 times greater. So you see, and the risk maintains for a period of 10 years after hospitalization, so it's a long-term consequence. And as a result of our cooperation with our partners, we are able to check infections and their consequences. So you see, every second sample sent by any hospitalized patient from any hospitalized patients in Poland were patients who did not survive an infection. Terrible statistics. So this is the mortality factor. I believe we could reverse these statistics, and this is really scary, especially when you realize that these diseases may be prevented by vaccination, which does not even have to be repeated, does not need a booster. So that's a vicious circle. And we need to remember that when we educate adult patients, it's not just about preventing infection, it's more. It's about having a positive influence on their future life with their comorbidity, with their primary disease. So when you see, we have indicated subsequent incidents of infections. So each incident on the way brings the patient closer to their death, which is not inevitable. So we developed a range of common recommendations by both the Polish Vaccinology Association and other specialized associations dealing with specific groups of patients. And now these recommendations should be helpful for family doctors, for primary care physicians, so that they know they're not alone with the patient. They have support of specialists. And if they have recommendations from specialists, it means there is scientific research to back it. So, because recommendations are never issued without credible residents, and if actions are not effective, they are safe. I will not elaborate on that. It's all included in the recommendations. It is also not the main subject of today's presentation, but look how detailed our recommendations are. They discuss the procedure depending on prior immunization or not. And it discusses every step of the process. So the level of detail in the recommendations makes it easier for the practitioners to follow. And the last thing I wanted to mention is the immunization program, which is a document for doctors, and this is it goes beyond mandatory vaccination, also recommended vaccination. They are equally important, not any less important. And I'm mentioning this because some parents, they just follow the obligatory program because they believe only the important ones were included in the program, and recommended are of less significance. They don't even want to talk about it. So we need to change the strategy. Recommended vaccinations are not less important. They are financed from a different source, yes. And in case of adults, most vaccinations are recommended vaccinations, but information about the possibility to get vaccinated is also a legal obligation that the doctors have. So you see, these are the recommendations for patients. And again, patients with comorbidities in the heart or lung area are the ones who should get such recommendations. And also, vaccinations are now included on the refunded medications list, so their prices are reduced. And we also try to make them more broadly available this way, so that more patients use this way of prevention. And I believe this is a good tactic. This is a good tendency for the influenza recommendations. And 100% recommendation, these are the free of charge vaccinations, are those intended for cardiovascular and pulmonary patients. Now, the flu, very important issue. It's a global challenge, also in Poland, underestimated challenge in Poland in many respects, because we only see the tip of the iceberg. And we just perceive flu as just an ordinary infection. And flu is not just an ordinary cold. It's not just a regular, ordinary infection. We need to remember that. So in the context of the flu, as with the pneumococci, we need to remember what is the influence of the infection on the overall condition of the patient. As Professor Augustynowicz mentioned, our immunity declines with age. I love the word immunosenescence. I love the word, but in fact, the effect of this phenomenon is wrong because it's a challenge for vaccinology. We need to find vaccinations which will enhance immunity among older generations, because among young recipients it's much easier. So in the context of flu, we have 8 times greater risk of stroke and 23 greater risk of heart attack. But also greater risk of pneumonia. But another aspect I would like to bring your attention to is there is 23% of patients who will become dependent on others, which in senior age is a fundamental issue. The fact that we are able to take care of ourselves and to live an independent life, that can all be changed by a flu infection. So it's not just about preventing infection, it's about improving the comfort of life and maintaining independence for as long as possible. Just as my colleagues mentioned, vaccinations keep you young and then maintain your youth. And again, I'd like to refer to some scientific data. So acute exacerbations of chronic obstructive pulmonary disease. Among patients who are reasonably healthy, quite independent, without any saturation decline, and they are able to do their ordinary chores, after an infection, their condition deteriorates and they require help of others, of third parties. So imagine a situation in real life. This is not just about prevention infection. So what we recommend for people with lung conditions is to get infections against flu, pneumococci, SARS, but also shingles. So again, all these infections strongly affect the quality of life, and pertussis is one important vaccination. My colleagues mentioned we need to track the epidemiological situation, for instance, with measles as well. You probably all follow the bi-weekly reports about pertussis. So compare 227 cases and more than 1,000 year to year. And I will bet my money that we are just noticing the peak, the tip of the iceberg. Most patients are not even included in the statistics because they have non-specific symptoms. They may be suffering from pertussis, but they are just not diagnosed. So please be aware that, especially when you diagnose your patients, there may be patients with measles, for instance. So especially in a population who has not received a booster in a long time, because among children who receive frequent vaccinations, frequent boosters, the population is quite safe, but among adults, it's quite a realistic threat. And let me get back to immunosenescence. So it also has to do with immunoresponse. So older citizens have a weaker, poorer reaction to vaccination, and it's also a challenge for vaccinology. So we provide vaccination with high dose, and so that's an example of tailor-made training. So people about aged 50 plus, it has been demonstrated by clinical research, they should get vaccination with a higher amount of antigens. It's more effective. And look at the number of countries which include that in their national recommendations to provide higher dose vaccinations for senior citizens. And I hope we will also be able to soon offer such doses for our senior patients. You can also see some recommendations in Poland that this should be a preferred form of vaccination. But if it's not available, it's still better to provide the regular dose. But if possible, we should give a higher dose vaccination for seniors. And now a moment which is not a very optimistic one, especially when it comes to flu vaccinations. We don't do flu vaccinations. A most determined group is the senior citizens in Poland, but they are way below the coverage, vaccination coverage compared to other countries. And the pandemic has brought some improvement, but it's a short-term improvement because already in 22-23 season, the coverage ratio was much lower, and when you look at the current season, it's even lower than before. So here, there is a huge job ahead of us. We need to change the perception of flu, and we need to change methods of prevention by emphasizing how vaccination affects different levels and different areas in your life. That will be more fair towards the patients. And also, vaccinology offers new possibilities, for instance, RSV vaccinations, which is a significant factor which causes serious infections among children, but also women and men, among adults. So now we start testing, and we see that patients in severe cases of infection, and they have comorbidities, and they are, let's say, 68, they are suffering from RSV infections. So now we start to realize how much of a factor that is, not just among the youngest generations, but also among adults. Look at the mortality factor by age group, and you can see in the table how the risk still increases if there is comorbidities. So preventive now has a new meaning. Preventive is a much broader thing. Coincidence is something that we can observe among acute cases of patients in cardiology, for instance, departments. This is all correlated. So we now have two vaccinations available in Poland that we can apply to senior patients, 65 plus. And one can also be used among pregnant women, and that's the fourth recommended vaccination just after produces COVID and flu. And that is the vaccination that can be used to vaccinate people who are women who are pregnant, to protect the mother, but also to indirectly to protect the baby, the newborn. And now the effectiveness. This is the result after one dose, and see how effective the vaccination is. It's compared to placebo group, and it's important to communicate this to patients. So you can see also how effective it is among different groups of patients, for instance, with the fragile group of patients who are the most senior group, or patients with comorbidities. And safety is another subject that I could elaborate on for a long time, but I don't have that much time. You can see that in many cases in Europe, this vaccination has found its place, and we have to adjust to this situation. We need to inform the patients. And look at the different populations. Patients with cardiovascular diseases or renal disorders are among groups who are most at the highest risk, and they should be vaccinated as a priority. It's the same like with the shingles vaccination, and it prevents serious infections which can strongly affect, impair patients' life. And they have a long consequences like shingles, neuralgia. So these are the groups of patients we should recommend those vaccinations to. And we offer a 2-dose program. So the registered group is for 50 years and older, but in case of immunosuppression, it's for any adults. So this now has been included on the list of reimbursement for patients among 65 plus patients, and that's the way to follow. And I told you about the vaccination calendar. You can find it on Szczepienia info page. I recommend that you visit a Polish Vaccinological Association website. And we have a special folder, lifelong vaccination. You can use the calendars that we prepared. They have slightly different graphic design, but it's based on common recommendations. You can use them. You can discuss them with your patients. You can use. You can also make reference to those materials. It will be much easier for you to have a dialogue, and it will be much easier for the patients to understand the subject, which is quite broad.
Jest wcale nie mała.
As you see, there's a lot of options for prevention. All you have to do is to reach out and use it. But before you can use it, you need to know about it. Thank you. Thank you, Doctor, for an amazing lecture. So the patients with respiratory tract diseases and CVDs will probably ask fewer questions and there will be fewer doubts because this has been covered. But something that lies ahead is another very relevant condition, epidemiologically speaking, that's diabetes. Diabetes and the lecture on vaccinations in diabetic patients will be delivered by Dr. Ewa Talarek from the Department of Childhood Infectious Diseases, Warsaw Medical University. It's no accident, mind you, that a pediatric vaccinologist will talk about vaccinating diabetic patients. It's no accident because for many years these youngest patients have been receiving many different types of vaccines that doctor had been promoting, encouraging. So maybe now it's time we focused on vaccination program for adult diabetic patients. Doctor, the floor is yours. You can use the green stuff or you can turn the mic on here. Okay, thank you. I'm good, thanks. Good day to you all. Thank you for having me today. A confession right off the bat. I do not feel comfortable after the presentation by a member of the board of Polish Vaccination Society, a very charismatic person, so my challenge is insurmountable. But Dr. Małecka had a wonderful introduction for my lecture too. I'm not going to repeat what you saw and what you heard. It's information about the relevance of infections in adults, especially in adults who are, how should I put it, very mature or senior adults, and also in adults with chronic conditions. But anyway, I will focus on one chronic condition specifically, the one that definitely increases the risk of infection and grave course of many an infection. Just a quick introduction, how do we divide types of diabetes after the change introduced by the WHO back in 2019? What is the change? 2 types of diabetes in small print have been added. Why small print? Because the Polish Diabetology Society actually does not approve of those changes. We have not reclassified our papers accordingly, and also the American Diabetes Association, they also do not follow that revision. Well, we all remember that the 2 basic types of diabetes is type 1 diabetes, which results from destruction of beta cells in the pancreas. It's either autoimmune or idiopathic process. And that is the type of diabetes which is diagnosed mostly in children, though not exclusively. And of course, the children, they obviously grow up and then they become adults in natural course. So it's not that we do not have any adults with type 1 diabetes. And then the more frequent, the most common type of diabetes actually is type 2 diabetes, which is the progressive dysfunction of insulin secretion by pancreas. Epidemiological data on diabetes in Poland, some facts and figures. These are the freshest I could get, okay? As fresh as I could get. There may be some more recent data, but I wasn't able to dig it out. Anyways, just please note two aspects. Between 2014 and 2017, well, we've had an increase, year-to-year increase of over 200,000 patients with diabetic diagnosis. And another pertinent point is the average age at diagnosis. Even in type 1 diabetes, this average age is an adult age, I mean young adult. But for type 2 diabetes, the average age of diagnosis is, well, the age which is generally considered as a senior age. It depends, basically, but usually we say that to be a senior, and I'm sorry to say that, if you're 50 or 50 plus, you're a senior, and the actual senior is when you're 65 plus. So type 2 diabetes is most commonly diagnosed just a day or two before you become a senior, tongue in cheek. So in aggregate, these are exorbitant figures. The scale is huge. I have not put a table for recent years because I couldn't find it, but the estimations say that in 2022 and 2023, the percentage of diabetic patients in the society will have reached 8%. So how huge that is. These are huge populations, to be brutally honest. As I say, diabetes increases the risk of infection in general, across the board, including the lower respiratory tract infections. It also increases the risk of death due to an infectious disease. Premature death, the death that could be avoided if it had not been for the infection. Specifically, the diabetic patients are more exposed to flu, morbidity, RSV, pneumococcus infection. Dr. Małecka dwelled on that. There's also greater risk of hepatitis B, a disease that we tend to overlook thanks to very effective vaccination that was available for years. Well, it's not that the entire population in Poland has been vaccinated against hepatitis B. And take my word for it, we still encounter cases of acute hepatitis B. Diabetic patients are obviously and naturally more vulnerable, simply because of the fact that in Polish conditions, this is still a nosocomial infections. Basically, a patient, because of the chronic disease, they are in hospital, and that's where they contract this nosocomial infection. They have to get tested, etc. They also do some subcutaneous procedures on themselves. And also, it's often said that diabetic patients have dysfunction of T cells. So if there is an infection, they are more prone to a fully fledged hepatitis. Pneumococcus infections, that was already covered beautifully by Dr. Małecka, so I will not say that again. Shingles. Diabetic patients, well, there's a lot of different observation studies, but at least 20% increase in the risk of shingles if you happen to be a diabetic patient. Likewise, there's an increased risk, should you contract shingles, there's a greater risk of, I believe, the worst complication of shingles, which is neuralgia. Shingles-related neuralgia, which can continue for years. I've really been impressed with Japanese studies. According to those studies, because of that specific complication, people commit suicide or try to commit suicide. There are attempts. And that's a very powerful proof of how terrible this complication can be and how dreadful. Now that we discuss infections in diabetic patients, we can take a look from the other side, from the diabetic side, so to speak. Because even if the infection doesn't happen to be severe, even if a patient doesn't have to be hospitalized, and luckily, fortunately, there is no premature death, I'm sorry to say that any infection, even if it's a mild one, it can definitely affect the course of diabetes. And in some cases, like flu, as Dr. Małecka said, 75% of senior patients with the flu, they have hyperglycemia for the first time, like, first time hyperglycemia. Being a pediatrician, for over 30 years, I've been working in the infectious disease department in our regional infectious hospital. So in my career, I've seen children with all types of infections, children who are treated with insulin pump or managed their disease with insulin pump. And even when the infection would subside, their blood glucose levels were still running crazy. This is a bit of a product placement again. This is the adult vaccination program for diabetic patients. So a nice graphic layout as developed by Polish Vaccinology Society. Although, just to be quite fair, let me say that the same will be shown in a graphic layout downloaded from Szczepienia Info website. So we have two product placements. But let me draw your attention to the vaccines which we believe are particularly relevant for diabetic patients. And the same position is actually included in the recommendations of Polish Diabetology Society. There's chapter 27 dedicated to vaccines. It's not a long chapter, mind you, as far as the recommendations go. And the key message is that, well, they are focused on children, that would be fair to say, but then in the narrative part, on top of flu shot and hepatitis B vaccine, they also write about pneumococcus, COVID-19, smallpox, measles, rubella, and mumps. According to this vaccination program, this is recommended across, flu vaccination is recommended across the population, from kids 6 months old. There's no pediatric limit actually until you get adult, and then 18 plus through the life course without any cap. In adults, we only has been using inactivated shot for the last few seasons, the 4 type flu.
Zaszczepił przeciwko grypie, no to jakby nie można tutaj spocząć na laurach, tylko to szczepienie po prostu musi być co roku powtarzane i wydaje mi się, że bardzo istotne jest to, żeby to szczepienie u pacjentów.
So it's important to make sure that with those more vulnerable patients, such as diabetic patients, the flu shots are done at the beginning of the season, simply because you never know when the lightning will strike, when the patient could be exposed and could get infected and get very ill. Of course, if you missed the very onset of the season and you're in the middle of the season, please do not believe that it's too late. You still have a very good reason to get vaccinated throughout the season if you couldn't do it right at the onset. The vaccination is free of charge if you're 65 plus. So it's for diabetic patients who are 65 plus, good for them. This is free of charge, and if you're 18, 65, there's a 50% reimbursement, which is the same as for any adult from that age group. Dr. Małecka spoke about a vaccine dedicated to 60 plus people. Such a vaccine will become available, I hope so, starting from the very next season. And yes, when you have a diabetic patient in that age bracket, you should absolutely recommend that vaccine to them. It's not just the Polish Vaccinology Society recommendation, but it's also the recommendation of the Polish Diabetology Society and many other distinguished medical societies. So I guess, in the best case scenario, that's the product to be applied as the product of first choice, starting in the next flu season, which is this calendar year already. Should there be no access, and also we don't know what happens to the reimbursement policy, we don't know how much it will cost, we don't know whether there will be some reimbursement or none at all, so in case it is available but the patient is not prepared to spend their money on it, let's just use whatever vaccination we can, which would be the standard one.
Przeciw pneumokokom, tutaj akurat
The pneumococcus vaccination in this calendar, the diabetic patients were actually listed as a group of patients who need this vaccine more than any other group. But the reimbursement is only for the seniors. So it's not good enough if you're diabetic. You have to be a 65 plus diabetic to deserve or to earn the right for a free of charge vaccine. I say it with regret. We're talking about this 13-valent preparation. But yeah, this is something that you should use at the beginning, and then this should be expanded after at least 8 weeks. It's good to administer a polysaccharide 23-valent vaccine, or replace the set with a 20-valent conjugated vaccine. But no reimbursement, okay? So far, it hasn't been reimbursed for anyone. So it's a, you know, it's a decision process. You have to talk to the patient because they would have to pay out of pocket. So you must discuss it with the patient and take the right decision. Let me revisit hepatitis B for a moment. I believe that a large share of Polish population has been vaccinated against hepatitis B, and I couldn't be happier because at the beginning of my career, I would encounter kids with chronic hepatitis B and even with cirrhosis resulting from hepatitis B. So it was bygones, okay, olden days. So I'm very happy and I'm an absolute fan of that vaccination. But if there was diabetic patients who had not been vaccinated, then they should be administered the vaccine in the standard 3-dose, 0.1 6-month cycle. For those patients and any other patient with a chronic condition, they should verify their response, post-vaccine response. If it's a new patient, do it from 1 to 3, 1 to 6 months from the end of the cycle. However, if you're dealing with a patient who is not naive and who says they had been vaccinated, or because of age, it seems they should have been vaccinated, or they have the records to prove, yes, I have been vaccinated, then it's also good to test their anti-HBs antibodies. And if it's too low, then the person should, well, of course, let's start with someone who had been vaccinated. We start with 1 dose, after a month recheck. If the response is strong enough, that's it. But if the response is too weak, you administer the 2nd and then the 3rd dose. And after the 3rd dose, you do the verification again. Some patients who had not responded to the first shot will respond properly to the 2nd one. But I'm sorry to say that there are patients who still fail to respond to the 2nd cycle, and for them, there's nothing more we can offer, I'm sorry. So should there be very high risk that they would be exposed to the virus, then only immunoprevention, passive immunoprevention, such as immunoglobulin, is the only option, the only course of action. Let me also say on the margin that this antibody exam, it is done free of charge for those specific patients. Diphtheria, pertussis, tetanus. Every 10 years, administer a booster. That's enough for pertussis. But for pertussis to be included, it has to be this proper, preparation with pertussis component. If we are at sea, we don't know, because adults would often say, I do not have any records. People like me, I have my own vaccination card, like pediatric age card. I'm an exception. Even among students, I said, I had never seen my own card, never in my life. What are you talking about? So now I'm addressing the younger generation in particular. Please make sure to find your paper card for your pediatric age vaccinations. It will be very useful to you throughout your life course. But if you are unaware, you don't know, you're at sea, then what you do is obviously you administer the vaccine with the 3-dose cycle. Even if it should be a person who does not have the record, but they know they had some vaccine, believe me, it will do them no harm if you vaccinate them again, and actually it might do them a lot of good if you proceed with the vaccination. Anti-COVID vaccine, actually that's the piece of cake comparatively, because all you do, you listen to the announcements of the Ministry of Health. We now have only 1 vaccine available, so diabetic patients who had been vaccinated before, they should definitely receive 1 more dose as a booster, another booster. tailor-made for Omicron virus. Finally, RSV vaccination.
As you saw on Dr. Małecka's slides concerning diabetes, increases the risk by 11 times when we discuss mortality or a severe case. Vaccination is intended for people 60 plus, and the protocol requires one dose so far. Perhaps this will be it, and the protocol will remain a one dose one. But in clinical trials, prior to registration, efficacy was confirmed also among patients. But what is even more important, safety was confirmed of this medical intervention. And shingles vaccination, in case of diabetic patients who are 60 years or 50 years or older, they can count on a 50% reimbursement. For diabetics, it's recommended even earlier than 50, because it's enough to be an adult patient who has had chickenpox throughout the lifetime. But in this age group, under 50, this is fully charged. But this may change in the future. Both vaccinations against the RSV are new ones, so we'll keep fighting to offer some simplifications or reimbursements for special care patients. And I'm talking about part or full reimbursement. And other vaccinations are measles and mumps and rubella vaccinations. My colleague has mentioned that the situation is dynamic. And yes, we have patients in my ward, and these are many patients, new arrivals are also there. And my patient is not just intended for adult patients. We also have children with measles. So something is happening with measles. And we need to make sure that our patients, among others diabetic patients, are vaccinated against measles. So that they receive 2 doses of MMR vaccination. And the same is true for chickenpox, because it's very contagious, and sometimes children also had to be secured with the insulin pumps. They had severe case. Vaccinations for adults are against charge. I would like to emphasize that qualification of patients for vaccination is no different than is the case for healthy patients, for healthy individuals. So we follow generally accepted principles, and there are the same counterindications, and the same situations require special caution. You are probably well aware that acute phase of a chronic disease, it's not the best moment to deliver vaccination, but for instance, patients who had unsatisfactory glycemia over the last few years, it's not an acute case. Sometimes there are situations when it's worth waiting to make sure that diabetes is better, for instance, in ketone acidosis or in high levels of hemoglobin. So it means that their diabetes is not controlled properly on a long-term basis. So the treatment has to be fixed. And such cases may need to postpone vaccinations. Now, the vaccination calendar, vaccination schedule, it's available at Szczepienia Info website, and you can see the age groups and the range of vaccinations, which are slightly broader. And we need to remember that diabetic patients are adults, so there may be some additional recommendations for extra vaccination. I would like to encourage you to talk to your patients about vaccinations, to spread the knowledge about vaccination among patients and their families. One of my colleagues mentioned that we need to form a cocoon around patients. These are not newborns. They are not strongly deficient, but they tend to get infected more frequently, and they tend to go through the disease more severely, so they need to be informed. Thank you. Thank you, Doctor, for presenting your lecture, a very interesting one. I also congratulate all the other speakers. Thank you very much. And now, we had such a morning session which was loaded with knowledge, so we deserve a 20-minute break. And I'll see you again at 12:10 for the second session of the conference. Proceed with the second part of today's meeting. And during the second part, I would like to invite Dr. Ilona Małecka again to present a subject which is vaccinations dedicated to patients with rheumatological disease. It's a very important group of patients. We bring your attention to the fact that most of these patients, if not all, require specialist treatment, immunosuppressive treatment, which influences their immune response, and it makes them function differently. So how do we secure those patients against, how do we protect them from infectious diseases? The floor is yours. Thank you. This lecture is a tough one because this group of patients is quite non-uniform. This group of patients involves many different conditions which are strongly, significantly different from one another because these patients are from the perspective of WHO, they are not senior patients. They start struggling with their diseases in the middle of their lifetime. So they require attentive approach because we usually introduce immunosuppression or immunomodulation as doctors. And now this allows us to control their conditions better. So advancement in medicine is quite significant. We now have access to expensive advanced therapies, but they do affect immunity of the patient, so they become susceptible. So in a way, we as doctors bring these patients in such condition, but it would be careless to forget about the lack of protection. And another thing that is important, that most of these diseases are autoimmune diseases. So there is a lot of myth and a lot of fear from patients, but also from doctors. They suppose that vaccination may intensify or deteriorate their condition, or that vaccinations may actually introduce new conditions. And I would like to convince you otherwise. We introduce recommendations. So if there are recommendations, it means there is a group of experts who have reviewed all scientific evidence on the subject, and both about the efficacy but also safety of vaccinations. And now I would like to go back to the calendar, the schedule for training, which you received in your handouts. I believe these calendars should be actually glued to primary care practitioners, to their desks. And I'm not discussing anything that is revolutionary or new. These patients need vaccination because of their primary disease, because of their immunosuppressive treatment and comorbidities. And we also know that morbidity and mortality among those patients is much greater than that compared to the healthy population. And I mentioned already the vicious circle. For instance, we have a rheumatic disease. I will be using this general term, which requires treatment. Treatment makes you prone to infection and complications, which in turn affects the primary disease. So we are struggling like a mouse in a laboratory. But in case of specific pathogens, we are able to break that vicious cycles by using appropriate prevention. So I want to show you that we have no Polish recommendations on this subject, but we don't need all Polish recommendations. That would be advisable because they would be adapted to the Polish situation, but we can rely on research and publications available globally. But there was a recommendation from 2019, and I translated it literally. The authors, in the introduction, admit that vaccinations or using this way of prevention is absolutely insufficient for this group of patients. And it's not only because of the fear, which is characteristic of the patients, but also the lack of knowledge among doctors. And we need to change that. We need to stop fearing. We need to start searching for scientific evidence. Is there really anything to fear? Can there be any negative effect for patients with rheumatological conditions, or the opposite? And that brings us to the question, is vaccination safe and effective as it is for the healthy population? I believe that if it was not, and here we need to show some faith, the recommendations would not have been prepared. So what the recommendations are? These are the European League recommendations for patients with rheumatic diseases, and there's also a more current version from American College of Rheumatology. And I would like to briefly present you the findings, the general principles. So the general principles may seem quite ordinary, but they are really very important, especially for the group of patients with rheumatological diseases. So we need to assess the health condition of patients at least once a year, and to check if they get their, let's say, flu shots every year. We also bring attention to the fact that patients need to be included in the decision-making process, so that they are aware what the procedures give them, and the rationale for vaccination should be provided so that they are involved and engaged in the decision-making process. So it's not just up to the doctors to decide, or a group of doctors to decide. Patients should be included. Family doctors often emphasize there is a need for support from specialists, but let me remind you, family doctors are specialists as well. But there is also other specialists. So family practitioners feel lonely, and their knowledge of vaccinations is quite significant, but they are lacking support from colleagues, from doctors dealing with rheumatology. So we, in the stable phase of the disease, of the condition, we should also proceed as we do in the case of diabetes. But some patients just cannot wait. So we may even provide vaccination in non-optimum moment, because we need to follow reasonable motives. For instance, in case of COVID pandemic, we cannot wait for remission of the primary disease.
Oczywiście najlepiej szczepić przed...
Well, of course, the best option is to do it before immunosuppression treatment starts. The optimum scenario is once they start the treatment protocol, because most patients do enter a treatment protocol. It's a treatment according to certain, drug programs. So for the vaccination to be a good, ground laying for this, of course, if need be, these have to be inactivated vaccines. For these patients, it matters. There are those who are dead, let me use that word. So such a vaccination can be used with much better effect, even if the response will not be as strong. And then there is the life, so inactivated or... But also, just to put your minds at ease, it's mostly not for kids. It's mumps, measles, rubella. But sometimes, you do it in the pediatric age, because when they are an adult, you might not be able to do it because they have chronic condition. But someone who's in their 40s and they had never been vaccinated against chickenpox, of course, they will be sick as well. Okay, so what do we recommend? We're still evolving around the same set of vaccinations. Flu, absolutely number one. Pneumococcus, yes, by all means. Tetanus, yes. And also please note, in post-exposure prevention, especially in those patients who have some immunosuppressive treatment, if there is a wound with a high risk of tetanus, we would be more ready to do this passive active immunization, because the patient may not respond to immunization in a way we would like them to respond. So that's the kind of tailor-made approach, case-on-case basis, by case basis. Hepatitis A, hepatitis B. I hope that, speaking about hepatitis B, most of our population has actually been immunized. Although, when we look at our pediatric records, it is quite frequent. You have a 5, a 6, a 7-year-old kid with a totally empty, blank vaccination card. They haven't been vaccinated at all, so it's hard to take things for granted and make assumptions. And last but not least, shingles. Shingles vaccine is quite relevant for this patient category because we have this inactivated vaccine now, not the one that used to be before. It actually had never been available in Poland, but this was the one that had the active substance. In this case, it's inactivated, so it's safe to be applied also for patients from younger age cohorts at immunosuppression period. Are vaccines immunogenic? Let me just quote 2 examples based on the studies, mostly on rheumatoid disease and lupus. We did have higher level of antibodies, but it was definitely at the level which allows for a good response from patients. My lecture is a bit difficult because, you know, there's all kinds of biological drugs. They come in various categories. So the most harmful are those that impact the number of T cells. So it's a very diverse group, and you have to do it on a case-by-case basis. Pneumococcus response, absolutely satisfying reaction, no matter the protocol. So you should make attempt at immunization because there's a very good chance that the patient will react accordingly. We have evidence-based findings. If you have a rheumatoid disease, you shouldn't do yellow fever vaccination. Unfortunately, this is for travel, right? So you often have to change your life plans, your travel plans, if you have rheumatoid disease and yet you cannot get this yellow fever vaccination. HPV, yes, we should vaccinate against that. It's for the first time today that we talk about HPV, but they get chronic immunosuppressive treatment. So it's not just for infectious diseases, it's also for cancer and other oncological diseases. And as you know, HPV prevents cervical cancer and more. So that's a very relevant patient group. In this context, rheumatoid disease and treatment is usually in young people. So people who still have a very, very genuine, tangible risk of being exposed. And also the cocoon strategy. Yes, I love that strategy. I wish the doctors remembered about it more readily. You have to get patient's family involved. It's not just about the person who has a condition and should get vaccinated. It's about their community, the nearest and dearest, because these are the people who will probably infect them if it should come to that. So in my opinion, we should absolutely get the whole family involved, do this own group together, make sure that you act on the broad front in a comprehensive way. Finally, American recommendations. Well, based on, the gap here, what do they start with? Every opportunity for this type of prevention in this patient group is worthy, and it's the right way to go. These guidelines are just the one of many recommendations. That's why we need to collaborate. I'm talking about the rheumatology doctor and the physician who will administer the vaccination. In Poland, in our system, you would not expect a rheumatology doctor, diabetology doctor, cardiology doctor to actually administer immunizations. No. They have a supportive role, auxiliary role to educate, but they just support the family physician or the GP. It's GP's job to take care of immunization. So This Polish Vaccinology Society has to make sure that specialist physicians in various medical fields are brought on board, and they also spread awareness. Because family medicine, GP, yeah, everybody knows, but other doctors, it's not that common, I'm afraid. What else do we have in the recommendations? The patient should be engaged. It must be patient-centered. The patient must know it's good for them, it's safe, and it has to be an informed decision on the part of the patient. So what do we have here? We have flu, we have pneumococcus, we have shingles, and in the American recommendations, we also have a very transparent recommendation for HPV.
Profilaktyka choroby nowotworowej.
So also for cancer prevention.
And I would like to show you this slide to demonstrate the complexity of the situation. Patients are complex individuals, not just based on their condition, but also on their treatment. So sometimes we need to analyze for how long can treatment be suspended. And in case of inactive vaccinations, we do not fear side effects. It has to be heard, but we offer opportunity for an optimum response. So if a patient may undergo a break from their immunosuppression treatment, they can create a higher concentration of antibodies, but that requires cooperation between a rheumatologist and a family doctor. I do not imagine in Poland a rheumatologist takes a decision to interrupt treatment, and also this would cause a high discomfort in patients because they might fear that we do not follow a treatment protocol. So we actually need to apply individual principles for treating patients. We recommend applying inactive vaccinations in case of some patients, but it's important that we do that, otherwise we wait for remission. But in case of flu and and pertussis, it's not always possible. So this recommendation makes our protocol simpler, and our position is also stronger because we can offer several doses during one visit, because some doctors tend to wait 2 weeks or 3 weeks before administering new vaccinations, but it's not reasonable. It actually causes a risk that the patient will discontinue at some point. They will not come for a booster because some neighbors may convince him or her otherwise. They might get some recommendations not to stick to their treatment program, to their vaccination program. This recommendation gives us more opportunity that vaccination will be more effective. For instance, we deliver flu and vaccination at one appointment. So the opportunities for effective vaccination are greater.
Nie będę Państwa epatować, ale pokażę tylko, że...
And I don't want to scare you or anything, but there's a separate, detailed set of recommendations on COVID-19 immunization, and I was so impressed because it was published so fast, so soon. I mean, as soon as the COVID vaccination program became available, this is so specific, so precise. You can actually track and trace this specific patient who received that specific drug, and you can pinpoint the perfect timing for the vaccination. Finally, product placement. Last but not least, Polish Vaccinology Society, the website with a tab reading adult immunization. It's a dedicated tab, and that includes all the information I told you about, the entire program for those patients specifically. And please, mind you, it's not the only vaccination that we can do for this patient group. No, these are people who like to travel more often than not. So travel medicine, vaccinations, why not? But this is just the core, okay? That's just the core in a nice graphic presentation to facilitate your patient encounters, patient interaction, to keep things simple. If you're diagnosed even with a severe disease which is treated with immunosuppressive drug, it's not a counterindication for a vaccination. It is not. It is not a reason to steer clear of vaccinations. When I talk to my fellow doctors, I tell them not to vaccinate. It's the easiest decision, right? Because then for a physician, it's a problem. They don't have to do this form of prevention. The patient has an easy life because theoretically they will avoid those side effects, whether they are likely or not. But is it really the best decision in the world? No, it is not. It may be easy, but it's not the right decision. What it does is to shift the negative consequences in time. So if you keep the patient uninformed, you actually take some of it on your conscience. What if the patient gets very sick later on? They will not be able to resume the regular activity, the regular life. And last but not least, the cocoon strategy. Vaccination is for the person with chronic condition and for the loved ones. This is an opportunity for the family, for the nearest and dearest, to do something good for that person who has a chronic condition. That's all. Thank you. Thank you, Doctor. Thank you very much for another amazing lecture. This was so true what you said, especially at the end. I'm really, it will stick on, okay, in my memory. This could be a tagline for this conference. Namely, you said that if you do not recommend vaccination to an adult, you take it on your conscience in a way, because you become co-responsible for their morbidity. So that's a very powerful message. Very well. Now, on a final note for this event,
No, można powiedzieć wykład, spotkanie.
So now what we have for you is, I don't know, a lecture, a meeting, a debate of two distinguished experts. They have already spoken during previous editions of our event. I would like to give the floor now to Dr. Monika van Kerut from the Infectious Disease Department and Pediatric Unit of University of Medicine in Warsaw, and Professor Tomasz Sobierajski from Sociometric Research Unit, Warsaw University. Madam, gentlemen, you are experts, and now you will discuss a very relevant topic, a topic that is close to the heart of every physician and every person who works with immunization. So what you're going to say will be the cherry on a cake. It will be the summary of the topic. And what will you talk about? Well, you will try to tell us how to talk to a patient about immunization, and you will tell us what questions to expect and how to reply to those frequently asked questions. And the background for this discussion comes with the guidelines. The guidelines that have already been presented today. So once again, please make sure to use them. These guidelines are co-authored by our guests. So over to you. Thank you, Professor, for having us for this very lovely introduction. Come on, why don't you stand behind the pulpit? You can come closer to me. Well, this is the last lecture, and we had absolutely fantastic speakers earlier on, so we feel challenged. I don't know, Monica, if you agree with me, but I had a long list of we're going to say ticked, ticked, done, already covered. So I'm getting really worked up. What else is left to say? Well, there is some information left, I hope. Actually, I believe that we will now share this information with you. Wouldn't want to keep it under the lid. So yeah, we'll try to wrap it up, summarize some of the findings. We already heard it today. COVID-19 pandemic was a game changer in a sense that very many people began to realize that, oh my gosh, so there are vaccinations for adults. Never heard of it. Because there used to be this mindset, vaccination is just for kids, and that's it. For an adult vaccination, if you were to go to Southeast Asia or you wanted to get a flu, that was the only opportunity where you thought that there could be a vaccine for an adult, but these vaccinations had a very low success rate. I mean, success rate in terms of the uptake. And then the other side of the coin is now we have more than 10 million specialists, 15 or so million experts who now know everything about vaccinations after COVID-19, I mean. And the physicians who talk to patients, they kind of think or expect that they will just say a few professional terms and the patient will know what they are talking about, so they don't do any lesson in vaccination, okay? They don't do the proper induction. And it's a bit of a clinch, and we would like to discuss this clinch situation today. And also, whenever I attend this event, I mean, whenever we step up, we try to bring some new research findings, and we have very, very recent findings on HPV vaccination for adults. And what do adults know about it? Dr. Małecka spoke about this. This study was carried out with the Patient Rights Institute in collaboration. And one of the questions asked during the study was on this dream vaccination. And it comes as no surprise to hear that the dream vaccination is a cancer vaccine. And we do have such vaccine against oncological diseases, so that's a very powerful argument. And before I stop this introductory part, let me say one more thing. I'm now addressing medical professionals. Whenever you ask doctors, physicians, what percentage of anti-vaccine people do you have in your surgeries, I would say 70 to 80% of people they talk to about vaccines. So 70, 80% of everyone with whom the subject is discussed, that's an anti-vaxxer. And why is that? Because everybody who comes up with a question or a doubt is immediately labeled as anti-vaxxer. That's it. But our study has shown beyond any doubt that we are in favor of vaccinations. The consummate anti-vaxxers would be 2%, 3%, statistical error, maybe 4%, not more. Those who are in favor of vaccines, it's 25%. It's typical, always has been 25%. But then we decided to include kind of a spectrum. So when you're not passionate about vaccinations, but you're in favor, and then where you're not passionate against it, but you're still kind of against. So these moderate views, over 50% of people are the moderate people who used to fly under the radar, but they are definitely moderate on the positive side, not on the negative side. They are more in favor than against. So what better context to discuss vaccine? You mustn't assume that the patient knows it all. And you mustn't assume that the patient is an anti-vaxxer. Even if they have a question or some case in point, this does not mean they are an anti-vaxxer and that's it. There's a very good chance that they will be in favor of vaccination, and the chance of it being otherwise is very slim. So a question to you, Dr. Van, because you've been a practitioner. So we've had this situation where you said we should get the patient engaged, get them on board, make them a partner in decision-taking, that it should be our joint decision. So here we go. What do we learn from the latest research about joint decision-taking in vaccination?
Well, thank you for this great word of introduction, Professor. As you can see, it's not that easy to get the floor because the professor has much knowledge to share. But this question was very relevant. I have been asking this question for a long time, and I have been convinced for years, this is how I have been taught, that engaging patients in medical decisions is the only right solution because it helps us get a better effect. And sometimes it is effective. But research shows us the other side of the medal. So I was very much surprised with the results of many different studies which show that we, as a doctor, in this role, we are there for the patient to talk. We are there available for a doctor's appointment, and it's our role to say, hello, this is your vaccination day. And you can be much more effective, much more successful by such conduct. It's like dealing with children. Instead of engaging them in a conversation and introducing this partnership-based model of cooperation, it's only effective in some situations. We, as doctors, are educated, and we should have some psychological knowledge to be able to indicate which patients need some discussion, some dialogue, but this group is insignificant. Most patients want us to be convinced and to take this decision for them. And they expect us to say, let's follow me and go to the vaccination study. And they don't want to have much to say. Well, it doesn't sound well, but it's a matter of being convinced and confident. If you start having a dialogue like, well, how about having a vaccination? It would be useful. The patient right away enters the doubt sphere, especially if a doctor says, what is your opinion about it? And again, we are convinced, we believe that patients have some knowledge about vaccination. And in truth, to be honest, they have not much, they don't know much, or they know nothing. So it's not enough to take an independent decision. And we can say, I understand that sometimes taking a decision may be difficult. As a human being, I do understand that. But we are talking about safety here. Vaccinations are safe, highly safe, so the risks involved are negligible. And if you don't leave space for discussion, well, as a digression, you know, I've been dealing with medical communication for a long time, communication between doctors and patients. And from the very beginning, I say that this promoted partnership between doctors and patients is misunderstood, and it doesn't lead us into a valuable position. Such relationship is meaningful only when two partners have comparable knowledge and are able to have a discussion as partners. In other situations, there is no partnership because there may be a vast disproportions in knowledge. So if a patient comes who, let's say, is a cardiologist or a diabetologist, or and they have a conversation with a family doctor, then a conversation does not have to be as conversation between equals, because family doctors have much more information about vaccinations. So relying on this concept of partnership may not be useful in case of vaccinations. So, as surprising as it is, it's better if we decide for the patients and say, it's great, today we have to vaccinate you against this and that, or I remind you there is a requirement to vaccinate you for a specific condition. And I am using also the phrase "we" because it's also important, because the decision is but it's made by the doctor. Also, using this plural version gives you a sensation of being taken care of by somebody who has knowledge, who is open for discussion, because it's not like a doctor is closing possibilities for discussion, but the decision-making carries certain responsibility, and the doctor is responsible for taking the decision. In Ukraine, I'm working with different patients, and they say that when they go to vaccinate their children in Ukraine, they have a document to sign that in case of side effects, they take all responsibility on their shoulders, which has a result of people withdrawing from vaccinations. And this is why the policy is much more complicated than that, but the level of coverage with vaccination in Ukraine is very low. But to me, as for a doctor, it's very difficult to change this approach. And there are many doctors who do not have sufficient knowledge about declinations. We just assume that they do. Now we have the era of measles and pertussis, and doctors believe they know all about vaccinations. But I actually get phone calls from renowned specialists from different professions, and they are surprised. Why do they get a vaccination? They're even surprised. It's possible for an adult to get vaccinated. And these people are doctors. They talk to their patients. They should advocate vaccinations among their patients, and they don't even know there is a program for lifelong vaccination. So it's a great job for family doctors, but there is also a great job for patients, because education of patients and education of individuals is important. And the subject of today's lecture is how to talk about training. But it's not just between a doctor and a patient. Also, patient-to-patient conversations are important. And you have a theory, right? How to talk with the anti-vaccination groups. Well, you don't. You just don't talk to them. It's a waste of time. It's useless. It's a waste of your energy. You need to change the subject. You need to talk about the weather, focus on the sun. If somebody is an anti-vaxxer, they do not come for a dialogue. They come to convince you to follow their path. So the chances that we'll meet somewhere in some meaningful place are null. So this is not a conversation partner to partner. It's definitely dominated by anti-vaxxers. But what you said about the fact that patients talk to other patients, yes, that's true. If patients are not convinced by a doctor to get vaccinated, they will start asking others. And we can see that in our studies, that there is a lot of space and a lot of work to be done. Because now, role models tend to go from doctors to pharmacists. And sometimes when patients have a thought of getting vaccinated, and especially among senior citizens, and then the person whom they consult are pharmacists, and that's clear. It's clearly visible in our research. And why pharmacists, not practitioners? It's because sometimes it's easier to, more accessible. You know, there's abundance of pharmacies in the neighborhood. There's a big social trust, public trust in pharmacists. So they go to pharmacies and ask pharmacists for advice. But it doesn't stop there. The dialogue starts in a pharmacy, and they ask regular salesmen for advice. And sometimes the knowledge about vaccinations, about those people, it's very limited. And in Poland, we have this tendency that if somebody asks you for advice, you do not deny advice, especially if you're wearing a white uniform. You do not say, I'm not a specialist, but they sell stories, they tell stories they think they know are true about vaccinations. And that is very important in this whole message, in conveying this message. It's also important to quote the results of our research, which indicate the level of vaccination coverage in different countries. Especially, I believe in some countries there is more than 50, 60, or even 80%. In countries where vaccinations became available in pharmacies. We only introduced this solution during the pandemic. But still, this is not a common procedure. We do not trust pharmacies enough to offer a broader range of vaccinations. It's too early for that. But the trust vested in pharmacists attracts people. And So there is a big forum, a big platform for sharing knowledge. So education is something I would like to emphasize. We should support education of pharmacists. Yes, you know how it works when you, especially you know what happens when even an influencer on TikTok pretends to be a biologist or a doctor, and they share untested stories, and they seem quite credible. But there's one thing I'd like to share about our studies. We examined attitudes of adult individuals about HPV, and we'll present the results at one of the conferences tomorrow. And during our conversations, it was quite common for us to use an argument that a doctor says that I got vaccinated against this and that condition, and it would be worthwhile for you to do the same. So this this formula, this solution works. And the reason we mention it, because it requires more studying, and it turned out that when we asked a representative group of adults among Polish men and women, and how they would react to such conversation, only 1 in 4 responded that this would be the main argument to get vaccinated. So more than half responded. Actually, nearly 60% said it would be one of the arguments, but not the leading argument, one of the supplementary arguments. But nearly 3 people out of 10 said such statement from a doctor would not even affect them. That's surprising. I have been told, and I taught others, that this is one of the arguments that we can use. Yes, they told me this. They taught me this at school as well. I remember my professor said 50% of what you have learned at school in 10 years will no longer be valid. So this is another example of things we learned are no longer valid. So the authority of us as professionals is not working anymore. So it's not effective to say I don't smoke anymore, and you could start considering stopping smoking. It's not effective. So how do we talk to patients? When do we talk to patients, especially when specialists have other important tasks to do, like set up treatment for diabetic patients and so on? They have no time to discuss vaccination. Family doctors usually have appointments when patients are actually sick, and they are not willing to talk about vaccinations at that time. Well, I would like to show respect to my colleagues from the Polish Association of Vaccinology. We absolutely use every opportunity to talk about vaccination. We do not wait until the flu season. We do not wait until somebody turns 60 or 65. We are not waiting until you go for holidays to Asia. We use every moment, every opportunity to talk about vaccinations, to signal. For instance, in case of vaccinations for children, for HPV, we inform patients during the first visit, during the first appointment with a newborn, even if the vaccination is scheduled for 10 years in the future. But there will be a moment when it has to be administered. So we just keep reminding, and we discuss it with the parents. We can also then discuss it with parents as adults. So I'm not suggesting that doctors should talk to strangers on public transportation and discuss vaccinations, but In your office, when you meet your patients, use every moment. For instance, if a patient comes with the flu during the flu season, when they are begging for antibiotics, that's the time to say, okay, don't say you should have gotten a vaccination, but that's a situation when you can mention vaccination as possible. For instance, the fact that you are sick now does not mean that in a month you will avoid another type of influenza. So you can focus on the patient's pain and say, see how severe your case is. You may alleviate it in the future. There's many patients that come to see their doctors, and the opportunity is lost. Sometimes grandchildren can bring their grandfather, for instance, brings a grandchild to vaccination, and it's a good opportunity to discuss lifelong vaccination with the whole family. And when a child is sick, they don't stay with a nanny. They usually stay home with their grandparents. And if they have an infection, their grandparents may get infected. And pneumonia is not just pneumonia, as our colleague mentioned, and RSV infection may stimulate that. And before, we thought the flu was responsible for pneumonia, but now we know RSV infection is something that is preventable. And I don't think we quite realize how important a finding it is, because people usually associate RSV with children, and it's important for children to see it's prevalent in adults as well. So hospitals are surprised by the recent findings, by the data. They are surprised. They even thought that the virus mutated and now it infects the adult population. It has always done so. We just were not aware. But okay, of course, don't say, okay, I told you, you should have gotten vaccinated, but use every opportunity to talk about vaccination. And on a final note, there is a product placement, and for those of you who are willing to know more about vaccinations, I truly recommend two fantastic Instagram profiles by Dr. Joanna Małecka. It's very knowledgeable, and also Monika Wanke include daily, fresh, super interesting information. Thank you for this meeting.
To my pięknie dziękujemy.
Thank you very much. Very interesting summary, I believe. I have one short sentence I would like to mention. We are used to having doctors in outpatient clinics who are overworked, who are busy with administration, who sit in front of their computers, handle forms. But I believe it's about good time management. And we need to have a dialogue with patients, and a lot of conversations need to be planned. So sometimes doctors don't talk much, and then patients start the talking. So maybe it's time to reverse the roles, and I strongly encourage you to do so. And now I'd like to thank you for this substantial part, this technical part, and we have a moment for a short discussion, about 10 minutes. So does anybody have any questions to the experts, or maybe you would like to ask them now?
Pani profesor.
Professor Linia Brydak, could you please make sure Professor has the microphone? I have a mic here to share if that's helpful. Madam, actually, probably this one doesn't work, but yeah, Madam Professor, welcome. Good day, Madam Consultant. I am delighted to have received the pleasure and honor of saying a few words. Madam, if you could please. Well, that's a committee thanks to, during this meeting, the Vaccinology Society was established. This is Professor Wysocki. This is Dr. Mrukowicz, Dr. Duszczyk, Maria Duszczyk-Gołębiowska, the late professor, now not anymore Dr. Czajka, she's a Professor Czajka now, and a year ago Professor Kazimierz Rutkowski passed away. So that was the constitutive group of passionate experts, and of course me. But since, I want to keep it modest, so I mention myself at the end. In the National Institute of Public Health, we have I've been here for over 55 years. 55 years and 4 months, to be precise. Why do I display that chart? Just for the reason that National Institute of Public Health is the only authority that can do clinical trials, and I was triggered by those telephones from women. A woman after mastectomy would call me, "Madam, I've had mastectomy, can I get a vaccine?" We have 33 elevated risk groups. We also have cardiological tests here carried out in the Anin Institute, and now they make part of mandatory recommendations for cardiological vaccinations in the European recommendations. So what you saw in that chart is repeated in the publication entitled "The History of Vaccinating Against Influenza in Poland." That's all from me. Thank you.
Dziękujemy pani profesor.
Thank you so much, Madam Professor, for your relevant comment. Because after all, flu vaccinations, for many, many years we have encouraged, promoted, propagated, recommended, and of course we all look forward to seeing this coverage rate of at least 50%, at least 50% of the population. I say at least 50%, that would really make our day. Well, that is the end of our meeting. Thank you so very much. I would like to acknowledge our excellent lecturers. We appreciate them being here with us. We appreciate all the knowledge and experience they shared with us so generously. Big thanks to all of you, ladies and gentlemen, for your time and participation. I would like to acknowledge all of you who could not be here in person, but thanks to the benefits of online connectivity, we have this streaming available, so thank you all. And, well, I hope that this tagline, "Trust in Vaccinations," I hope it will resound as a message we take to the whole wide world. The world, the people we meet at work every day, everybody comes with their own challenge, but vaccination calendar, vaccination program isn't just for children. It's for the entire population throughout the life course, in health and in sickness. So once again, thank you very much for being here. And if you can bear with me, I have an announcement to make. Directly after this event, maybe with a bit of a time lag, at 2 p.m. here in this very room, we are going to hold a press conference. A press conference for vaccinology, pharmacoeconomics experts, physicians. This will be a press event for them to take the questions from the facilitator. A journalist will facilitate that. And the topic is how to improve access to vaccinations in Poland, how to create better routes for access to vaccinations. So if you have the time, If it's up your alley, please make sure to be here at 2 p.m. For now, thank you and goodbye.